Hi, this is Pete Fernbaugh. Welcome to Trinity Talk. My guest today is Renae Dailey. She's a nurse practitioner in the cardiology department here at Trinity Health System. Renae, thank you so much for being here.
Thank you so much for having me.
And congratulations on your career change into electrophysiology. We'll touch on that in just a bit. How long have you worked for Trinity?
I have been with Trinity for over 20 years.
Okay, great. You look like you've only been with us for 5. So, so over 20 years. Have you always been a nurse practitioner?
No, I actually started as a registered nurse. I was in telemetry, then went to critical care, and then eventually emergency department. And along the way, I obtained my nurse practitioner.
That's quite a career trajectory. What made you want to become an NP?
Actually, it was just because my own health issues. I was having a little frustration. No one would listen to me. I had some issues that were going on with my body. And then I realized that my body would not be able to be a nurse for the rest of my career as well. So I started taking some classes and did that and became a nurse practitioner.
I think those personal experiences are the great motivators that really do lead to improved patient care, because now because of your experience, you realize how important it is for a patient to be heard.
I understand their frustration.
Yes. And I'm sure they are relieved when you can express that kind of empathy to them, because that's a common complaint from patients, is they just don't feel heard. What in your experience, what is it that healthcare is such a difficult profession? What is it that keeps you in this career? Because so many people have left. What is it that you like best about it? What keeps you going in it?
It is actually just helping a person.
Yeah.
I'm very fond of helping others as well as teaching others about their health.
Excellent. And that education component is so important. And as we've talked about you before we started recording, you're still educating yourself.
Correct.
On everything.
Correct.
Cardiology, when you moved into cardiology, was that an intriguing move?
It was. And the heart always fascinates me. We only have one.
Right.
And it's just fascinating to me that it just continually beats. It never stops. It never rests. It just continually goes. And there's so many components to it. We have the plumbing, which is cardiology, or the electrician, which is electrophysiology. So kind of intertwining those throughout, and learning different things about the heart is just fascinating to me.
As a professional, it has to be tough to keep up on all the new breakthroughs and all the new information that is being... I've talked to others in your department, and I'm overwhelmed by the amount of information they have to process. There's so much happening in technology.
Correct. And there is a lot of new technology happening. As we mentioned before, the LAAO, we just had our 200th procedure here.
Yeah, you just mentioned that we had our 200th LAAO procedure. Another acronym. It's your whole day probably is acronyms.
Correct.
What does that stand for the layperson?
It is the left atrium appendage occlusion device.
And what, give us just a brief synopsis of that procedure.
So on the left atrium, there's a little appendage that kind of sticks out, and that's where 95% of clots form. So they just put a little seal right over top of that, and that helps keep the clots in there and they don't come out. So
is that an outpatient procedure or?
It is.
I mean, that's one of the most remarkable.
I believe sometimes they do keep them overnight just, for precautions, but, mostly as an outpatient.
Well, I remember when my grandparents had bypass surgeries, triple bypass, double bypass surgeries. They were in the hospital for a week or more. And now it's amazing how so many procedures involving the heart are outpatient or just a night in the hospital. So it is a really remarkable time. Now, that's quite the accomplishment in a whole string of accomplishments that the cardiology department has racked up over the years. You recently transitioned to the electrician side.
Correct.
Electrophysiology. Once again, treat me like a layperson, because I am.
It's just an area where they deal with fast heart rates, slow heart rates, pacemaker insertions, defibrillators with heart failure, if your ejection fraction or the pump of your heart is low. So those are just kind of a brief scenario of what we endure.
Now, one of the reasons we wanted to speak with you is you're trying to let patients know where they can find you, and you're trying to attract new patients, of course.
Correct.
So what kind of patients would come to see you as in the electrophysiology department?
Sure, it would be patients that have slow heart rates, fast heart rates, your SVT, tachycardias, atrial fibrillation, patients that have unknown syncope episodes, POTS patients, just different procedures or different patients that have electrical issues.
Now, the term POTS patient, I'm not familiar with that. So what kind of condition is that?
So this is a condition where patients, when they stand up or change positions, their heart rate would go up and then normally they pass out or have like syncopal episodes or pre-syncopal symptoms.
When you say syncopal, now that is
passing out.
Passing out. Okay. So when these patients come to see you, what can they expect in general?
For POTS patients?
Yeah, for a POTS patient.
So we usually try to do some testing just to make sure if it is POTS or not POTS, and then figuring out what is going on. Sometimes they wear a monitor. Sometimes they will do what we call a tilt table. We can treat with medications, and there's just basically treating the symptoms. POTS patients are very difficult to treat. They become very frustrated, unfortunately, just because the symptoms everything is kind of patient-based. So what works for you may not work for somebody else. So it's just finding what works for that person.
Sure. So, and it can be a bit of a process, it sounds like.
It is. It's a long process.
No wonder the frustration happens, which is good that you can hear that patient's frustration, because I'm sure it can become pretty clinical after a while if you let it. And I know that that's probably one of the challenges in healthcare, is to make sure it doesn't become that you're treating each person as an individual patient.
Right.
When an AFib patient comes to you, what's just generally, what can they expect?
Dr. Clue is very educational with his atrial fibrillation patients. So making sure that they're on anticoagulation, he can treat with medications, he can do cardioversions, he can do ablations. You know, he has a lot of knowledge and background to do and treat those patients.
And you mentioned patients with pacemakers. I know sometimes those get out of whack. I assume that's part of what you do as well.
Correct. Pacemaker interrogations just to make sure that the pacemaker is functioning. I do not take the pacemakers out and put a nail, but when the battery becomes low, you know, Dr. Clue can change the battery for them.
So, genuinely the electrician of the heart. Yes,
correct.
Yeah. What is it that you enjoy most about working with cardiology patients?
As I stated before, cardiology has always been a fascination to me. It's just a lot of information can be provided. So education is very important for our patients. And just also educating that exercise is very key.
Right.
A lot of it, going back to the POTS patients, exercise, that core muscle, getting that stronger is basically one of the most important treatments of POTS.
Right. Well, mentioning education, mentioning exercise, one of the things that always strikes me when I hear stories of cardiology patients is how much it transforms their lives once that issue is resolved or being managed. That has to be a rewarding aspect.
It is very rewarding.
Yeah, you probably see like a personality change. I mean, it's incredible just how one health problem can inhibit a person's whole life.
Correct.
And that has to be one of the most rewarding aspects.
It is. I saw a patient earlier today. He had an ablation with Dr. Clue a couple months ago. He was in for his follow-up, and he could not stress how happy he is, and he's back to his normal living. He's able to do his daily task. He's not as short of breath. The palpitations were very debilitating for him. So it was amazing to see that, something that he has dealt with for so long, and one procedure and done.
That's incredible. Well, congratulations on your new position. Where can patients find you if they have?
In the medical office building in Suite 202.
Excellent. Right here at Trinity West.
Correct.
4000 Johnson Road. Well, thank you so much, Renae, for being with us.
Thank you for having me.
Absolutely. And good luck as you move forward and continue to amass knowledge and be overwhelmed by all the technological breakthroughs. So it's an exciting time to be in medicine.
It is very exciting.
But thank you so much for being here. And thank you for watching. We will see you again next time.